My name is Zach Anderson. I'm a third-year resident over at Naples Community Hospital. And today I'd like to talk to you about a rare case of pulmonary origin sarcomoid carcinoma that a patient presented with an acute abdomen and as well as cardiac compression. So a little bit of background about this cancer. Pulmonary sarcomoid carcinoma, or PSC, is a very rare malignancy, and it only accounts for about 0.1 to 0.4 percentage of all lung cancers. It's a very aggressive cancer in nature, often found when patients come in with metastatic disease. Common places that typically likes to metastasize are the adrenal glands, the liver, and even the bones. When patients do present with initial complaints, typically those are pulmonary in nature with shortness of breath, dyspnea, or hemoptysis. This case was very unique as there is no documented cases in the literature of PSC in which patients present with cardiac compression or an acute abdomen. So I'd love the opportunity to talk about this case today. So here I have a 76-year-old male. He's got a history of non-obstructive CAD, diabetes, hypertension. He comes to our hospital in the setting of progressive worsening abdominal pain. He was previously seen at our institution in which he had multiple scans done, in which a known mass was found on a biopsy of origin in the thoracic region. However, this time he presented, he was having rebound tenderness, signs of peritonitis. He had a leukocytosis at 21.4. He had a hemoglobin at 6.9 and elevated creatinine. He had imaging performed that showed an enlarging mass in the small bowel, in which surgery was consulted in the ER, in which the patient went for an exploratory laparotomy, in which the bowel was resected, as you can see by our figure 2, in which the patient has the mass present after the procedure. Additionally, on the initial imaging, the patient was also found to have cardiac compression as well as pulmonary compression that can be demonstrated via figure 1 of our CT abdomen and pelvis. After the patient went for procedure, he did quite well with the procedure. He was monitored up in the ICU. Additional testing was performed in which the patient had pathology suggestive of a leiomyosarcoma, mutations in KRAS and T53, in which this patient was started on immunotherapy and followed with outpatient. Now, the reason this case provides clinical significance is that this is a very rare carcinoma. In addition to that, there are not any cases in which a cervical abdomen or cardiac compression and esophageal compression is demonstrated in the medical literature. Because this is an uncommon cancer, and even more an atypical presentation, it adds value to see just the different types of presentations this can occur with and regarding PSC. Typically, this is a cancer that is very metastatic in nature, with early detection being quite challenging. Although typically these patients do not do well with traditional chemotherapy and radiation, there are new studies regarding immunotherapy. So if we can get earlier diagnosis on these patients, that would be beneficial from a treatment perspective. However, what makes this case is very unique is just the atypical presentation, the clinical symptoms that the patient presented with, as well as a very unique cancer that he presented with. So thank you for the opportunity to speak on this case today, and thank you so much.